Hi, I'm Dr. Towfigh. I'm a laparoscopic and hernia surgery specialist at the Beverly Hills Hernia Center. The plan today is to operate on a gentleman who's been suffering from chronic pain since his hernia repair. As you may know, an inguinal hernia is a pretty common diagnosis, and the repair with it, there are various ways of repairing it, and it's usually with mesh. In April of 2015, he had an open inguinal hernia repair with mesh, and he did fine until this past year. Now he's chronically debilitated from this pain, and no one's been able to figure out why he has the pain. Specifically, he has a recurrence, which makes sense. If you're doing fine after your hernia repair, then a year or two later you have pain, it's not going to be from any other real complications such as a mesh-related problem or a nerve problem. And unfortunately, those are basically the two diagnoses that he was being touted about until he reached me. We got imaging with Valsalva, so he gets a bear down imaging, which mimics people standing up or coughing or increasing their abdominal pressure, and that's the imaging that showed he had a recurrence. The mesh is fine, it's in the correct position, he just has a recurrence, and now the mesh is tugging on his spermatic cord. So every time he stands or has any activity, which is, what normal people do, the hernia pushes through the mesh repair, and the mesh is stuck to his spermatic cord, so it's now also tugging on his spermatic cord. So his main pain, besides groin pain, is testicular pain. And that's also another reason why his treatment was delayed, because everyone was focused on his testicular pain, not understanding it was all referred pain from his hernia recurrence. So our goal today is to fix the hernia, remove the mesh off of his spermatic cord so his testicular pain is treated, re-repair the hernia with mesh again, because mesh is not the problem in this situation, and hopefully he'll be pain-free. All right, we finished our timeout, guys. Can I start? So this guy already has a left inguinal hernia repair, and so I'm going to use his old scar because it's a redo, and I have to remove some mesh and also put in, possibly do a neurectomy. I may have to enlarge the scar a little bit more. AdSense, please. Thanks. All right. It's not reacting. All right, scalpel, please.